Hi, I'm Dr. Johnna B, occupational therapist, educator, and researcher, and this is OT Translated, translating occupational therapy for everyday education. If you work with adolescents or teens in any occupational therapy setting, whether that's school-based, outpatient, mental health, or community-based practice, you've probably encountered challenges with your clients around motivation, emotional regulation, or unhelpful thought patterns. And that's exactly where cognitive behavioral therapy, dialectical behavioral therapy, and motivational interviewing techniques can really come in handy. And yes, these evidence-based techniques do belong in occupational therapy practice. Let's talk about it. Mental health isn't separate from occupation. It's interwoven. So teens struggling with anxiety, mood disorders, trauma, or identity development often also experience functional challenges, and that can be related to school, hygiene, sleep, social relationships, and even self-advocacy. As occupational therapy practitioners, we're not just supporting regulation and routines, we're addressing cognitive and emotional barriers that get in the way of meaningful engagement. And that's where frameworks like CBT, DBT, and motivational interviewing become functional tools and not just theories. Let's start with CBT, cognitive behavioral therapy, and exploring how we can use CBT techniques to challenge distorted thinking. We often use CBT thought records or catch it, check it, change it strategies to help teens recognize distorted thought patterns that show up in daily life. Here's an example. Maybe a teen avoids class presentations because they think, everyone will laugh at me. We help them to track the situation, their automatic thoughts, emotions, and behaviors, and then we challenge the thought and reframe it. Maybe to something like, I might feel nervous, but I've prepared, and some people might actually relate to what I have to say. Now, why is this OT? This is an OT tool because we're not just reframing thoughts, we're linking them to performance in school, social confidence, and goal-directed behavior. Here's some other CBT tools that you might want to try. First of all, the CBT thought record that we just mentioned, the ABC model, antecedent, belief, consequence, and functional reframing scripts that you can use during occupations. Next, let's explore how we can use dialectical behavioral therapy, or DBT techniques, in OT to help teens with emotion regulation and distress tolerance. As OT practitioners, we can integrate elements of DBT into occupation-based sessions, especially with teens who are navigating identity, rejection, and emotional overwhelm. Here are a few key DBT skills that you may want to explore further. The first is the TIP acronym, which is helpful to employ for immediate distress. It stands for temperature change, intense exercise, paced breathing, and paired muscle relaxation. Next is the STOP acronym, which can be helpful for impulse control. It stands for stop, take a step back, observe, and proceed mindfully. And the third is the wise mind practice, which can be a helpful tool to balance logic and emotional thinking patterns. Now, what's the connection to OT for these different skills? Because teens need practical tools that they can use while they're doing things that matter to them, like managing social media use, initiating homework, or navigating family dynamics, DBT gives them the simple language in the form of acronyms and structures for managing their emotions that impact the occupations that they need, want, and are expected to do. Finally, let's talk motivational interviewing. When a teen is stuck in ambivalence, I want to change, but I don't, motivational interviewing can help us to meet them with curiosity instead of pushing. It's collaborative, it's client-centered, and it's deeply respectful. In your next session, try using these motivational interviewing techniques. First, ask open-ended questions. What would be different if this changed? Next, affirm and validate. It makes sense that you're feeling stuck, and honestly, it takes a lot to admit that. Lastly, reflect and summarize. So it sounds like a part of you wants to show up for school, but another part of you feels like it's pointless. How does motivational interviewing fit in with our OT practice? Because we are working with clients to create meaningful habits, routines, roles, and rituals. And motivational interviewing helps to ensure that our clients tap into their own reasons for change, not ours. Remember, these tools do not live in isolation. A teen might reframe a thought using CBT, calm their nervous system using DBT skills, and then identify their why using motivational interviewing all in one session. And here's how that could potentially look functionally. During a hygiene session, we may explore what thoughts, CBT, and feelings, DBT, are coming up, and then reflect on motivation through motivational interviewing. In school-based OT, we may link class participation avoidance to distorted beliefs, emotional overwhelm, and the teen's own goal of wanting to feel proud of their own work. These approaches aren't extras. They're foundational tools in building functionally meaningful, trauma-informed, and culturally responsive care. Whether you're an OT practitioner, an educator, or a caregiver, you can integrate these evidence-based strategies into the real lives of real teens starting today. Now let me know in the comments which of these are you already using and what do you want to learn more about. Also, don't forget to like this video, subscribe to OT Translated, and share this knowledge with a colleague who also supports teen mental health through function. Until next time, friends.